This topic is about refeeding syndrome. Refeeding syndrome can occur whenever we try to reintroduce caloric intake too quickly in clients who are severely or chronically malnourished. An example of this type of client would be someone with anorexia nervosa. These clients are used to a decreased amount of glucose or calories within their body, so when we reintroduce these nutrients, we need to be very careful. Because these clients have a decreased oral intake, their body naturally produces less insulin. Once we start to reintroduce these nutrients, whether it be through oral intake or IV fluids with glucose, we're going to increase their glucose intake, and therefore their body should respond with an increased insulin production. Now, with insulin, there are certain electrolytes that will follow it wherever it goes. Potassium will always follow insulin, they're best friends. So whenever potassium leaves the blood and enters the cells, the body will have a deficiency of potassium in the blood. We can also see the same effect with phosphorus and magnesium. All three of these electrolytes are going to move out of the blood and into the cell, and that creates a decreased level of these electrolytes in the blood and therefore a deficiency. Let's first discuss potassium. Potassium is the electricity of the heart, and so when we have a decrease of potassium or hypokalemia, the heart is going to get irritable and cause cardiac dysrhythmias. Phosphate helps the muscles contract effectively. So when we have a decrease of phosphorus in the blood or hypophosphatemia, the muscles will be weak. Once we see muscle weakness on our clinical assessment, we need to intervene immediately because this can progress into a severe complication such as respiratory failure. We have to remember that the diaphragm is a muscle as well, and the diaphragm and the muscles surrounding it, the subcostal and interstitial muscles, will be affected, and therefore the client will not be able to breathe effectively. Magnesium helps the muscles relax. This can be concerning because magnesium will also affect the heart muscle. When the heart muscle is not able to relax due to that decrease in magnesium, it's going to contract more than it should. This will result in preventricular contractions. We discussed that these clients are now having an increased intake of glucose, and their body should be creating more insulin to manage and maintain blood sugars. Sometimes the body is not able to keep up since it's been so used to having a decreased production in insulin. This can result in hyperglycemia. Now, there are life-threatening complications that can occur specifically with the heart. Remember, potassium affects the electricity of the heart, phosphate helps the muscles contract effectively, and magnesium helps the muscles relax. If all three of these electrolytes are deficient, this is going to be a compounding effect to cause heart failure. So our number one priority is to safely increase oral intake and advance the client's diet as tolerated. We always need to make sure that we're assessing nutritional status, and we can do that with daily weights to make sure they're gaining weight effectively, as well as checking prealbumin or albumin levels to make sure there's enough protein in the blood. Monitoring and replacing electrolytes is also a priority. Monitoring the heart is also important because we want to avoid or prevent any of these life-threatening conditions or dysrhythmias. Collaborating with a dietitian early on with a malnourished client is extremely important so we can prevent any of these electrolyte deficiencies.